We've had patients come in and we just put on magnesium supplement. By the time they come back, they're feeling better, they're sleeping better. So sometimes you may have a simple solution for something that seems like a complex constellation, where in some cases, the doctor may give you an antiarrhythmic, then they give you a sleep medication, and they give you something else for anxiety. Sometimes simple solutions can be there, so you put some time thinking about it.
I'm presenting for a 9-year-old female. The first time we saw her here in the clinic was 6 months ago. Initially, she came complaining of palpitations. This is the main symptom: chest discomfort and generalized muscle pain or joint pain. Her history consists of a diagnosis of thalassemia trait. Also, she has a history of venous insufficiency, costochondritis, also fibrosis, so a lot of things, and also diagnosis of anxiety. So we run a lot of tests, blood tests and echocardiogram, and also we put a heart monitor to evaluate the heart rates and the palpitation.
Let me take a pause here. So, the very interesting constellation of symptoms. I know we have more data you want to share with me, but I'm just going to share my thinking with the audience right now, because this reminds me of the old morning report, right? You come in, blah, 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 blah. Oh, what do you think? So let's just put these things. Palpitations she has. She also has a history of anxiety. Now, what does palpitation and anxiety have to do with each other? Well, I'll get to that in a minute. She also had venous insufficiency and a thalassemia trait.
Yes.
So let's take the palpitations. Palpitation is a complaint that patients give, and we don't always know what it means. Someone comes in and says, "Oh, I have palpitation." Patient A will have palpitation. That's what do you mean? I have a skip beat. Patient B has palpitation. Well, my heart's racing like it's about to jump out of the chest. Patient C has a palpitation. It kind of quivers irregularly off and on. What were her palpitations like? Rapid, pounding, skip beat?
Yeah, rapid. That's what she mentioned, that she feel like her heart racing.
Now, would it gradually rev up or just come on all of a sudden and stop all of a sudden? Do you remember?
Actually, she mentioned that she just feel it and then stop and then it come
back. Yeah.
Yes.
So that's an important characteristic, because when you feel it like that, it makes me think more of an arrhythmia, an abnormal heart rhythm. Abnormal heart rhythm can vary from anywhere from the upper chambers, atrial fibrillation, atrial flutter, lower chamber, ventricular fibrillation. Not that can pass out, but some people get ventricular fibrillation. It comes on and off. Ventricular tachycardia, PVCs. So you can get abnormal heart rhythms that all of a sudden on, all of a sudden off. Occasional skip beats are like isolated beats like PACs or PVCs or premature beats in the upper and lower chamber respectively. So it seems like she had an arrhythmia, which could be maybe supraventricular tachyarrhythmia or atrial flutter or atrial fibrillation. Those are possibilities. What might that have to do with the anxiety? We know that certain mineral deficiencies, magnesium being one we see frequently, zinc deficiencies can also cause this, but magnesium deficiency can be associated. Does she have insomnia?
Yes, she has insomnia, and one of the tests we did is like the micronutrient test.
So again, we'll look for magnesium. So this is, I don't know the results of the test, we're going to find out, but we want to think about these things from the differential. Is there all anxiety, palpitations? Well, magnesium is a common denominator. Zinc could be a common denominator. And if they have insomnia, that's the third thing. So why don't you go ahead and tell us what we found, what we did.
Okay, so the complete blood count showed like low iron levels and like low hemoglobin. There is some deficiencies in the micronutrient test, but we put this patient on nutritional regimen, and on the follow-up next time she showed improvement. Actually, over these 6 months there is marked improvement. We can say like every time we're monitoring the heart rate and it's like about more than 80%, we get like normal heart rate.
She didn't have an arrhythmia, it was just the heart rate was just fast.
Yeah.
And the palpitations lay on one side versus the other. I remember this patient, we talked about her. She was prescribed the beta blocker, but she was afraid to take it. She was a little bit anxious in general. And when she came back, the anxiety was gone. Now, we did put on a heavy dose of magnesium, which probably helped some of that. The nutritional thing put in metabolic balance. And so oftentimes It's not just one micronutrient, but it's an imbalance across a whole spectrum of things, some of which we can measure, some of which we can't measure. And so as she became better nourished, inflammation went down, biochemical and physiological balance came into play, her tachyarrhythmia, and she probably had a high sympathetic tone. And with that high sympathetic tone, that's probably why she had such a high heart rate. That sympathetic tone was decreased. What I mean by sympathetic tone, we have a balance in our central nervous system. We have the fight or flight. That's what we call the sympathetic system, the adrenaline system. And then we have the vagal system, which slows things down. They keep each other on track. And some people have a little bit more fight or flight. Some people have a little bit more vagal. And some people get excess fight or flight. And that's due to a lot of reasons. In her case, metabolic imbalances. We put a lot of trash in our system. A lot of chemical preservatives in our food, various other things go in and throws the body off balance. So we may have more adrenaline. Versus in some cases, we may have more vagal. That may have something to do with the gut. The microbiome may be imbalanced too. And so there are lots of things that can be going on with the body. And by optimizing nutrition, it actually feeds the microbiome. It actually puts you in better balance. So it's pretty interesting with her. The nutrition went a long way, as well as targeted micronutrients. So she felt better, less anxious,
Yes.
sleeping better.
Sleeping better.
And she was coming in with this tablet with all of the symptoms.
Yeah.
The last visit, she had no tablet.
Yeah, because she's not more feeling like the fast heart rate. She can sleep well.
Yeah, we weaned some medications too. So again, a remarkable case, a spectrum of conditions, typically are very, very difficult to manage and treat. But if you take a foundational approach, which is nutrition, target micronutrient supplementation for biochemical balance achievement, you can get a lot of benefit in a very short period of time. So anyway, I hope this was helpful to you as it was to us, and we look forward to seeing you in future episodes. Until then, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.